All right, looks like we're getting folks on board. Are you there, Scott?
Hey, Dan, I am here, man. How you doing?
Great, good. How are you?
I am okay. I'm
Welcome
hanging
to
in.
everyone joining us. We're going to try not to waste a minute this time and get everyone on board and talking. So everyone can unmute themselves if they'd like to speak, and feel free to turn on your camera because we interact better that way, I think.
I agree completely.
Yes. Makes you feel like you're not so isolated. I'm just hitting admit all every few seconds here. It's now turning 12:30, so why don't we go ahead and get started, Scott?
Awesome.
All right, oops. Welcome everybody to yet another edition of Meeting of Membership Minds. I'm so glad everyone is joining us and during these really turbulent times. And we really just want to get into the discussion, get things going, and hearing from as many people as we can about what's going on out there for membership programs, especially in the association world, and you know, with what you're dealing with right now. I'm here with Scott Ozer from Scott Ozer Associates. Hi, Scott. And again, please feel free to unmute and speak. One of the first things that we wanted to talk about, Scott, you kind of mentioned this to me, was that we wanted to just talk about communications, how you're communicating to your members. You know, a lot of things that I saw a few things come up in Collaborate, ASAE's Collaborate on that. And I think that's a great discussion. What's going on, whether you're sending communications out regularly or how much have you changed? Maybe have you switched up any channels of communication, made the timing, anything like that. Tell us what you think. Feel free to chat as well.
Cool. And Dan, I'll just jump in real quick. I think I was on a conversation the other day about more or less exactly that. And somebody brought up a really interesting question, and I'm curious, I will just throw this kind of into the mix, which is, what are you doing with your, let's call them normal communications? So we've got weekly e-newsletters that just go out, and we've got other communications that just go out to our members. And so I'm curious to know if associations are adding to those, meaning more frequency, meaning more regular contact, or if they're changing those and tweaking the messages and changing the resources and things. So as we're talking about what you guys are doing, let's keep that in mind as well.
So feel free to unmute and speak. I'm trying to let everyone in here.
We've put a hold on most emails to Spank CEOs until everything's done, because we're sending them so many urgent, critical updates, and we're posting on a lot of, we've done about 8 webinars so far. So we've put a freeze on anything that would be going out. I mean, I wanted to do something for National Volunteer Week, and that, you know, had to get the Pope's blessing to go out. So we've scaled back considerably on anything that's going out that's not pandemic related.
Hey, Leanne, who are you with?
I'm sorry, American Bankers Association.
Oh, awesome. Great. Thank you. So you have scaled back, you said.
And Leanne, I'll follow up with that since we seem to have a quiet group all of a sudden. Did you do that based on gut or based on data, or what prompted that decision? Just because you felt that your members were being completely bombarded in every different direction at this point?
That's it. They're getting bombarded with everything, not just from us. So it was a strategic decision to scale back, because we knew they were already getting a ton from the company, and we've struggled. We have 375 staff, so we've struggled to get a handle on everything that's going out to them. And the easiest thing to do was to announce a company-wide freeze. Everything has to be funneled through marketing at this point if you need to send anything out. And there's a group that'll decide whether or not it can go out now or later or not at all. So it was mostly based on what we knew was happening. And we're in discussions now. I've just started discussions about our dues billing and what the messaging is going to be. That goes out the last week of June. And it's $41 million. So we're discussing what the dues is going to be, but we've committed to sending it out when we normally do.
Awesome. Yeah, Leanne, I would think you guys would be hopping right about now with everything that's going on with banks, and every small business, big business, and in between wants to talk to your members.
Mhm.
Exactly. That's why we're trying to be careful about how much. The only things we're going to send them are things that we really deem relevant right now. We don't want to overwhelm them. They know we have the stuff there. It's there. It's passively marketed on our website. We have an extensive page for all the coronavirus stuff. They know our training. Our training shot through the roof. Our online training is, all the bankers are at home right now, so it's getting a ton of use. So they know the resources are there year round, and they can still get to them if they want to. We're just not going to put it in their face right now.
Wow. Well, that's great for engagement.
Yeah.
Get them familiar with your trainings and things. That's great.
One of the things we're doing is we're having a webinar or a discussion with our corporate members today. We've brought in a couple of our institutional members who are the IT departments in school districts who are a little busy right now trying to get everyone set up with remote learning. And so one part of the conversation is, don't call us right now, from the institutional members to the vendor partners. This is not a time that they are going to try something new that's been untested. This is not a time where you're going to start a relationship with someone. It's a time when if they need something, they will definitely be reaching out to you, but they don't really want to get 6 calls an hour trying to sell them or even give them a product that they've never tested before.
Well, Brian, I know who you're with, but who are you with?
Yes, please.
I'm with COSIN, the Consortium for School Networking. Our members are the IT departments in school districts, and so they're a little bit. So we have cut back on our messaging as well, just because we know they are so busy. I sent out one reminder about our dues. Usually launches in March. I did delay that till the first week of April. The message was very much, your membership expires. Some people have asked us, the status of their membership. Your membership expires June 30th. Here is a link to renew, but focus on what you need to focus on. I'm cutting back the number of renewals I send them right now, but I'm still going to be sending them renewals. And I launched a win-back campaign with a similar messaging, here are the resources that we have. You may not have seen this because your membership lapsed last year. Here are the resources we're providing to all school districts, regardless of membership status, around coronavirus. But if you'd like to rejoin, here's how you do that.
Are you doing that by email, Brian?
Yeah.
Okay.
They do not want to be called.
Yeah, I've been seeing some interesting conversations around that, where Marketing General just put out a blog post this week, I think, or maybe last week. As many of us know, every day is kind of blending into each other at this point. But if their telemarketing efforts are working very well, I do some telemarketing as well. And a few of the people that work with me have said they can't get a hold of anybody, that it's all rolling over into their cell phones. And because you can't really identify the numbers then, that people aren't picking up the phone. So I think it's definitely worth trying, but it's also important, as Brian said, to know that if people are answering or not answering, or what they want and what they don't want right now. So
well, we've reached out to our board and been like, what's the situation for you? And we've taken our guidance from them because they are the ones living this. And they seem to be pretty much in agreement on it. So we've been kind of letting them tell us when it's a good time to reach out, sort of thing.
Yeah, that's pretty smart. They are the member representatives, on the board. So getting that. I'm thinking if you're unmuted, then you're in line basically. So maybe Joel, did you have some something you wanted to ask or say?
No, not at this time.
How about Alan?
I do.
There's Alan.
Yeah,
Alan,
I do.
Who are you with, Alan?
So I'm with Spectrum Printing and Graphics here in Rockville, Maryland. I have 2 different channels here. So Spectrum Printing and Graphics is doing a couple of different things, and we service the nonprofit association, spiritual organizations, private school sector. That's pretty much our niche market. So what we've done is we've come up with some interesting campaigns right now surrounding the schools specifically. So my neighbor across the way has a graduation congratulating their senior who's graduating from Poolsville High School. So we have put out similar things for signage to congratulate the seniors who are going to be graduating, but unfortunately are unable to be at school right now. They're learning from home. This week, we're actually taking that one step further. And next week is National Teachers Appreciation Week. So we're doing the same thing for the teachers to promote the appreciation of teachers and our educators in our school systems, be it private school, public school, whatever school. So we're trying to get creative with how our messaging is to prospective customers and existing customers, you know, in a very difficult situation to continue to promote printing, graphics, direct mail, etc. So that's what Spectrum's doing there. And so far as messaging and trying to reach out and outreach to prospective customers and existing customers, it's really about, for us, I find myself having to email everybody because it's very difficult and challenging to get anybody on the phone. What a lot of my conversations though have been over the last 7 to 10 days, and what my messaging would be to the group and everyone on this webinar is, yeah, I understand that you would cut back based on your budgets and what's going on with your specific association. My only suggestion would be, don't stop doing what you've always done. So if your messaging and your marketing was a combination of web and mobile and telemarketing and direct mail and print and online training, whatever that mix is, keep doing all of those things, understanding that, yeah, you have to draw them back based on your organization, your vertical market, your industry, etc. But keep doing those things, because once you turn the spigot off, you don't just turn the spigot back on and it starts flowing again.
Yeah, well,
So,
Alan, I'm glad that you said that. You know, that I'm with FMI, the Food Industry Association, and actually we kind of delayed and stopped sending out renewal notices. We're on a calendar year basis, so most of our members had already renewed, but we had a group that still had yet to pay their dues. So we stopped and delayed it. And then, you know, once you start it back up, or, you know, you send it back out, it's almost like you're trying to turn the spigot back on for the organization and shore up your organization. Yet it's scary because, you know, you are going to get those rejects. You're going to get rejected more now than you were before. And, you know, and then it's just about, well, how do you handle that? How do you know, try to figure out how to keep them on or have them reconsider their decision, knowing that they're dealing with a lot of issues on their end. So,
yeah.
Is Paul up next?
Oh, thank you. Let me see here, make sure I'm not on mute.
No, you're good. I can hear you.
Okay.
You're good.
Okay. So thank you. I'm the executive director for the Pennsylvania Association for Middle Level Education, and we are an affiliate of the Association for Middle Level Education, which is our international parent organization. I feel like the small guy here, tiny compared to everyone else we've heard from so far, but I would still want to share a little bit about what we're doing. We have about 7,400 members, which are administrators, teachers, university folks, pre-service teachers currently. And what we're trying to do with all of those people is to share with them the kinds of resources and materials that we find are beneficial and appropriate for them. We're not necessarily screening all those things, but we're making them available. That's coming from a lot of different places, obviously, and school districts are doing a lot of that on their own. But there are still people who are out there looking every day for a new twist or something that they can do. That's part of the educational field. So as far as that, that's been our primary communication to members. The exception to that would be those members who have their membership coming up for renewal. We're on a rolling basis as compared to having an annual set date where it might be established for the whole organization. So we have memberships that are coming up for renewal throughout the year at different times. And what we've done there is to provide those members all the time and a regular send email that's automatic from our system. And what we've done is changed some of those communications so they were softened a bit. We realize right now that not only aren't administrators and teachers in buildings, but they don't have folks that they can access to actually go ahead and purchase whatever they're going to purchase. They're all on hold. So we're telling them that their membership isn't going to expire, that we are extending it at least through June 30th, and that we do want them to continue their membership because of their value. And that's pretty much what we're doing. It's we're very small. We have a state board of 30 total members, and out of that group, there are 24 that are voting members. The other ones are ex officio in nature. We meet a couple times a year. So when we've met recently, it's all been virtual, of course, and they've done a lot of thinking about what's going on and a lot of sharing. My primary personal contact has been exactly that, talking with administrators and teachers who are looking for specific things and trying to get a good handle on exactly what's happening here in Pennsylvania.
That's great. Yeah, staying in touch.
Can I dive into something real quick? You mentioned when you first started speaking that you guys are pointing out a lot of resources and pointing them to resources and things. I came across something interesting. It's sort of tangential to our world. It was more of a personal email that my father forwarded to me he has a timeshare, and he forwarded me this email from the people who manage the timeshares, from the timeshare company. They had all of this information about coronavirus and how you should wash your hands and how you should eat healthy and how you should get sleep and blah, blah, blah. And I'm thinking to myself, why would I ever rely on or expect for these people to be sending me this and giving me tips on my health, right? It just seemed totally out of the blue. So I throw that out there just because I'm curious to know how you guys are deciding what resources to send them to, because they're everywhere and we can look at it so many different ways. I have an opinion on that, which I'm not going to share right now. But for this one example, they sent me these things and I was like, you guys run my dad's timeshare. Why are you telling him to wash his hands? And I was like, it just was totally out of the blue. I was like, what? Who are you and why? So I'm curious to know how you're filtering through everything that you're filtering through to decide what you do want to share. I know you're not, endorsing any of it, but how are all of us deciding what resources we do want to share? Because that one, again, was totally out of there. I was like, what are you guys doing? But I'll stop talking and let you add in.
Okay, so ours is very simple. If it comes from a member and they have tried it and it's research-based, that would be something that we'd be willing to share with our members. If it comes from our national organization, our international organization, those would be topics and best practice professionals who are sharing that information. And that's what we choose, nothing else.
Yeah, and that's what we've been doing also, is just compiling whatever best practice is going on out there and kind of curating it, compiling it, and putting it into some type of easy to review format, infographic, PDF, whatever it takes, just to get the information passed along to whoever it is. So thanks Paul, for that.
We're trying to make that very simple. We're sending a very brief blurb and a URL code.
Oh, there you go.
So go right there and look at it for yourself.
Okay. So I'm going to open it up to Jennifer Richards, who's with AAAE.
Hi, I'm with the American Association of Airport Executives. So our industry has been devastated. Our airports are running at about 5% of what they were at this time last year. So we're an individual membership organization. Dues are on a rolling basis. We have about 7,200 members. We anticipated that because a lot of airports are owned by cities or authorities, that our members wouldn't be able to pay their dues right away. So we ended up just sending out a blanket email to anybody who was renewing in the next few months and saying, if you need an extra grace period, let us know, and we will extend your membership now rather than lose you and have to try and get you back later on. I had about 60 people that took advantage of that. So 60 out of 7,200 isn't too bad. Of course, it didn't go out to all 7,200. We do as far as the information that we're pushing out to our members, we do about 80 meetings a year. So this has been really devastating for us as well. We pivoted very quickly and started offering a lot of the stuff that we would have offered at our annual conference or some of our other conferences that are coming up in webinar format. Our training department is rapidly changing to an online format for both certification proctoring and for our other types of exams that we do. And our federal affairs department has set up a page on our website. It's our pandemic page. They used it back during 9/11. Well, maybe not quite back that far, but during the other pandemics that we've had in the last 15, 20 years. So there's a lot of messaging that goes on with that, but it's basically, they just do a webinar every day at noon. And the guidance that they provide is from TSA and FAA. So we're not really pushing out a lot of, wash your hands or anything like that. But we have stayed with all of our online campaigns. We have campaigns set up that nurture people onto our website and get them to join. We have renewal campaigns that run for 4 months. And then we have a win-back campaign, and we actually changed our win-back campaign for our members to let them know that, we really are working on your behalf right now. Our online community has become really central to what our members, how they communicate with each other. And we've only had that for about 1.5 years. So getting them back and letting them know that we have this community that's really, really gangbusters right now is helping to bring new people in. We're in a unique situation because in the past, 8 or 10 years, dues is only 2% of our budget.
Wow.
So, but our services department is taking a huge hit because we badge employees at airports, and we run an app-based transportation. So anytime Uber or Lyft come on the airport parking or airport property, there's a fee that they pay. So we're taking a hit there. And so we're really trying to ramp up membership and, supplement as much as we can right now with that.
Wow.
Yeah.
Jennifer, for your win back, are you guys doing that by email?
Which part? Yeah, a lot of it. Yeah.
Yeah.
Almost everything. We use Informs, and we have some really highly customized campaigns that we've done in there. And so it nurtures them through it, and then different steps that they take, and they go into other parts of campaigns, and it's very successful for us. But I mean, right now it's, we'll take any penny we can get. So
Yeah. Gotcha. Cool.
Thanks, Jennifer. I want to make sure we get to as many folks as we can. So Nikki, you're up.
Hi, thank you. This is Nikki Mendez. I'm from the San Mateo County Medical Association. So all of our members are physicians that are on the peninsula here in California. And I just wanted to jump back and make a quick comment with regard to the email that Scott's dad had gotten. And one of the things that, and I'm sure I haven't seen it verbatim, but I think you summed it up quite nicely. But the first couple things that I thought was obviously they're trying to do it to be relevant. And B, that's interesting because you remember it and your dad forwarded it. So now that made them top of mind because it was something that you think this is not normal. So in a way, I think what they did worked. The other thing I was wondering is if they tied that to something like, we want you to stay healthy. So that way, when travel opens up, you can enjoy your timeshare again. Because that would be something, that they could have tied in to this coronavirus message. The other thing is we obviously have some very busy doctors, but we also have some doctors who are not on the front line. We're also aware from a recent article in the San Diego Business Journal that they're predicting about 1/3 of the practices here in California just may not survive this. And if they do, they are going to be slammed. So for us, we're kind of looking at I don't even know if it's a feast or famine issue at this point. So me and a couple colleagues, we talk regularly on Monday. So we are trying to brainstorm around different ideas, how we can remain relevant without bombarding them with the same information. We also don't send out the wash your hands, do this. But what we try to do is take a look at the different types of other professional organizations, including our state organization, that may be doing different types of webinars on whether it is the PPP or how to keep your practice going while the coronavirus is happening, how to work remotely, because for many of these doctors' offices, this is not anything new. Working remotely, they have to see somebody most of the time, or the telehealth is something that we're thinking maybe this will be a bigger issue once they get back to work, to where they'll do more telehealth for inquiries, but still have to see patients that need to be seen because they have something, or if you can't do a physical over telehealth. One question I did want to ask, because we had also gone to our board of directors and said, okay, what do you think we should do? You guys are there, maybe you're not on the front line because they're from a bunch of different disciplines. We didn't get a whole lot of information on what to send out. So one of the things we are kicking around is sending out a very quick survey, just asking members, even non-members, what is the type of information that you would like to see, so that way we make sure to get that to you, or what kind of services. And I was wondering if anybody on the call has done that during this period, and if you have, what have been the results?
Anyone want to answer that?
I'll answer it with a non-answer and say, Nikki, I think that's a great idea. I think that that's what we should be doing. I really do. One of the things that I would suggest, or that just popped into my head, is as opposed to actually sending out a survey, could you do a pop-up on your website? Because I'm guessing that your website traffic is up a ton right now. So just do a one-question pop-up saying, what can we do for you guys right now? And then you may need to make a multiple choice, because otherwise you could potentially get rambling answers that you can't really compile. But do you need more online education on topics of whatever? Because I think right now, if your website is something that people rely on and trust, the traffic should be up. And so that's a good way to do it without being too invasive, or also sending out thousands of emails and getting a 1% response, which isn't really going to help you much anyways.
Thank you. That's a great idea. I think my marketing and communications manager's on here, so I hope he wrote that down. If not, I'll brief him on it.
All right, we're going to be going a few minutes over the 1 o'clock hour, just to keep things going a little bit before we have to cut things off. But Stephen, you're up now. Stephen Brock.
Thank you. I'm Stephen Brock, and I'm with the Alliance for Academic Internal Medicine. So our members are medical schools and teaching hospitals that have internal medicine residencies. So pretty much with everything that's going on, it's really related to everything that they do. We have cut down some of our communication, partly because we do about 3 or 4 events a year, and we've canceled everything through August right now, so there's no marketing or anything going out about that. And we have an event scheduled for October, but we're kind of just holding off on that to see how things are going. We still are doing a weekly email that has about 3 or 4 hot topics that are of interest to people. The other thing that we've done to try and not inundate people, because we're knowing that everyone's really busy in our association right now, because is we actually, our communities there's like 5 major groups within the organization that have their own little communities. but we've opened up a community for everyone that is strictly about COVID-19. And we have a whole resources page on our website for that, whether that's reaching out to ACGME and how they're handling things for the next year. Also, this is right around the time that it's called the match, where medical students are trying to get matched with programs for a residency. And so there's been a lot of discussion in several threads on our community about how can they do interviews and what about tests that they normally have to get evaluated. So a lot of that is being handled through our community, which the traffic on that is just through the roof right now. And that's probably a lot easier to handle than trying to send out emails on each of these topics. So that's one of the things that we've been doing. Several people have noted about membership dues, and that's actually a big one for us right now. We also are on an annual basis, but our membership runs July 1st through June 30th. And so we're actually in the process right now that probably in about 3 weeks, we'll be sending out our dues notices. We were going to try and make some adjustments on that to maybe move towards a email sending out of notices. It goes to the hospitals itself as opposed to the individuals. The hospital pays the bill, and so it operates a little bit like a trade. The hospital pays the bill, and then the members just get membership as a result of being affiliated with the hospital. But right now we have not opted to, we automatically have a 3-month grace period. So most people are covered through about September. And we are not currently at this time planning on making any adjustments to that. But it'll be interesting to see how things go, and we may need to evaluate that as we see things come in, because one of the threads that's been coming up is the hospitals, at least from the people that we're hearing about, because of everything that's been going on, they have a lot of accelerated costs or higher costs with treating more people for COVID-19, but a lot of their ancillary revenue streams, cosmetic surgery or elective procedures have all been canceled. And so they've got a whole lot more expenses with a lot less revenue coming in. So at this time, we're not planning to make any adjustments for membership, but we'll have to just kind of continue to see how things play out over the summer. So that's how we've been operating in this situation right now.
Okay. Thanks, Stephen. I want to try to get more folks in here. Susan Piles asked a question, is anyone adding any additional member benefits to their package, for the same or for slightly higher investment to increase the help to members and the value of membership? So is anyone actually doing that? I'm not sure. I mean, we definitely aren't changing our value proposition right now. It's more about trying to, bring more attention to the value that they get and why it's so important to be a part of it.
And this is Daryl Walter with Solid Waste Association of North America. So we have folks that are on the front line, they're essential workers. So we've added a couple of webinars on safety dealing with COVID-19. So, getting this out to their managers and directors is essential information.
Thanks. Okay, and I don't know, Betty, are you still there?
I'm here. Hi.
Okay, hi. You want to try to squeeze it on in?
I'll be quick about
question?
it. So I am with the American Association for the Study of Liver Diseases, and we have about 7,000 members that are hepatologists, postdoc, PhD members, trainees, residents, and fellows, and some students, and our advanced practice group. We have found that we have been in the thick of this since the whole COVID-19 pandemic started. Our physicians jumped in and we took the first lead in working to get guidelines together for not only hepatologists, but those that are in the related GI world about COVID-19 and patients that have issues with both having the disease, the virus, in addition to acute hepatology or liver-related diseases. We've been very fortunate to say that we've had 3 webinars on the topics. We've been having them every week, and we've had upwards of over 1,000 people, members and non-members, register for these particular webinars. They are led by experts in the field. And we've been very fortunate to have a pretty good response on our warm lead acquisition for the 300 or 400 non-members that attend these webinars. Very fortunate in that. Our disadvantage in our situation and challenge coming up is our membership year starts July 1. We are not changing any of our membership renewal messaging, or we're kind of tweaking it a little bit to be a little bit more personalized per category. Unfortunately, our AMS doesn't play nice with informs a lot of the times, and we have trouble getting data out of our AMS. I'm sure everyone can relate to that. We're getting ready to have a governing board meeting in a week, in which our budget had to be cut by $4 million because we have had to cut programs, seriously cut programs, including our big one, which is our liver meeting in November. We've already decided that it will be going virtual. And what's affecting us is not only the income from the registration, but I'm starting to stress about, we have several hundred people that register who join the association to qualify for the lower membership member registration fees. And the fact that we'll lose out on about $4 million in revenue in terms of registration. And our exhibitors are primarily big pharma companies. And if you work with any of them, I can tell you right now, they're already planning through next spring, and they're not going anywhere. They're not doing anything. They are looking to work with companies who are doing virtual meetings and how they can play a part in our virtual meeting in terms of sponsorship, which is going to be a whole lot less money. So we're kind of struggling on 2 ends. And my main focus and my main challenge is the messaging that's going out there after the budget's approved. We've always been a well-off financial organization, but now we have to go in and say, we're cutting $4 million from our budget. And we're going to hear a lot of, well, you've always said in your past messaging that you're financially stable. Why are you making these changes, and how's that going to affect us? Our membership rates have not risen in 10 years, $375. We're very fortunate to have that happen, although we were going to raise them next year, but I don't see that happening now. But I guess it's becoming a bigger challenge to weigh the loss in income to membership, new members, and the loss of income to a large annual meeting that you're going to go virtual. And if anybody has any tips or advice about, the virtual sponsorships and the best way to play nice with the big pharma companies that want to do stuff, but we're still trying to realize the platform that we're going to be doing this meeting in. And so for right now, we are becoming one of the leaders in the field, but later down the road, it's going to be even more difficult.
Thanks, Betty. We're going to have to wrap it up here. I think the meeting time will actually cut us off. So I just want to make sure that we say a thank you to everyone. And it seems like there's a lot more to discuss. So please send Scott and myself any questions that you have or things that you want to discuss, and we'll try to schedule a new one in the coming days. So everyone stay well. And thanks again, Scott, for co-presenting, co-hosting, however, my co-host there, our co-host. Thanks again, everyone, and have a great day. And again, stay well.
Thanks, everybody. Stay healthy.
All right, I missed all the action, Dan and Scott.
Well,
yes, you did. That's all right. You got your piece in, you got to hear, so that was all good.
Yeah.
Okay, cool.
We recorded it. So.
All right, good.
Thanks,
are you going to be on next week again too?
We haven't decided yet. Scott and I are going to have to discuss.
Yeah, we're going to do something. I think we agree we'll do something.